All right, let's get started. So I want to welcome everyone to the Firearms and Rural Youth Mini Symposium session. For those who don't know me, I'm Megan Ranney. I'm an associate professor of emergency medicine and director of the Brown Lifespan Center for Digital Health here at Brown University. I'm also a member of the FACS Faculty Consortium, and I'm super excited to be moderating this afternoon session on firearms and rural youth. I personally do a fair amount of work with 4-H and know the importance of firearm ownership, particularly to our rural youth, in terms of hunting, in terms of heritage, and in terms of their way of life. And so discussing both what their perceptions are and how to help keep them safe is a topic of critical importance as we put kind of the bigger context of firearm injury together over the course of this day. So with that, I'm really excited to welcome our three presenters, two of whom are with us live and one of whom will be joining with us via pre-taped video. The first will be Nicholas Stange, who is a medical student at St. Louis University School of Medicine, who's going to explore the presence of firearms and storage practices in the homes of rural youth. His talk will be audio recorded. After that, we'll go to Dr. Charles Jennissen, who is a clinical professor of pediatrics and emergency medicine, yay, at the University of Iowa, and had the pleasure of meeting him before and so excited to reconnect here today. He's going to discuss his work looking at firearm use and training among rural youth, including whether or not they are receiving formal trainings. This is of just the utmost importance. Again, things like 4-H are great in terms of training a lot of kids, but it doesn't necessarily touch all of them. And then finally, Cole Wymore, who's a research coordinator within the Department of Emergency Medicine at University of Iowa, will talk about rural youth's personal experiences with firearm injury and their attitudes towards safety measures. As you guys have hopefully already gotten used to over the course of the day, after the three presentations, we will have a Q&A session. So as a reminder, to submit a question, use the little Q&A feature located in the bottom of the Zoom menu. Send them in before the presentations end so that we can have a chance to review them, and then I will ask them of our participants. As a reminder, the session is being recorded, but only the presenters and moderators are visible. Chat is disabled, so please use your Q&A to send questions. Feel free to tweet. And if you want to hide the captions, please click the up arrow next to the transcript button and click Hide Transcript. So with that, we'll begin screen sharing the presentations and get started. Our wonderful behind the scenes assistants are going to queue up Mr. Stange's presentation.
Hello, my name is Nicholas Stange, and I'm currently a first-year medical student at St. Louis University. Today, I will be presenting research on firearm presence and storage in rural youth homes that I did at the University of Iowa with the help of the individuals listed here. I will start off with a little bit of background on why this area of research is so important. Suicides account for 2/3 of all firearm deaths in the United States. And across all suicide attempts not involving a gun, only 4% result in death. However, approximately 90% of firearm suicide attempts end in death. The firearm suicide rate in children and teens has increased 65% in the past decade, making it the second leading cause of death for 10 to 19-year-olds. Almost half of youth suicides involve a firearm. Studies have also shown higher teen suicide rates in states where more people own guns. Again, 43% of teen suicides use firearms. That makes it the most common successful method by males and the second most common for females. Suicide rates with a firearm are almost 2 times higher among rural than urban residents. We can see from this graph here that the more rural a region of the United States is, the higher their suicide rate, with the national average being depicted by the solid line. Research has shown having access to a firearm triples one's risk of death by suicide. Children and teens are very impulsive, and quick and easy access to a lethal means of killing themselves puts them at a particular risk. Preventing access to a lethal means of suicide is a major objective in preventing suicides among those at risk. Access to firearms is also very relevant when it comes to unintentional shootings, of which more than 3/4 occur in home, and in most cases, the person who pulled the trigger is a minor. A 2014 study of fatal and non-fatal pediatric firearm injuries found that a third of the cases, the victims shot themselves, whereas in about half, the victim was shot by a friend or family member. In 68% of the cases, the firearm was owned by a family member. Safely secured firearms is associated with a reduction of unintentional shootings in children, even after adjusting for firearm prevalence. Case control study has shown that youth in homes with safer firearm storage had lower risks of both self-inflicted and unintentional firearm-related injuries. With this background in mind, we sought to determine firearm exposure and storage practices in the homes of rural youth to try and identify factors associated with having firearms in the home and of unsafe storage of these firearms. To gather this data, we surveyed attendees of the 2019 Iowa FFA Leadership Conference at the University of Iowa Stead Family Children's Hospital safety booth that you can see pictured here. The data was collected anonymously regarding the presence of firearms in the home and their storage. We also obtained demographic data, which included age, sex, race, and where the FFA member lived. We then performed descriptive and comparative analysis. We had almost 1,400 FFA members complete the survey, with equal percentages of males and females, and age ranging from 13 to 18 years old, with about a third being in the younger age group, 13 to 15, and almost 2/3 being in the 16 to 18 age group. When asked where you live, 53% said they live on a farm, 18% said they live in the country but not on a farm, and 29% said they lived in town. And 95.5% of our respondents identified as white. When asked about firearm prevalence, 84% said that they have rifles or shotguns at their home, and 58% said that there were handguns at their home. Over half had both rifles or shotguns and handguns at their homes. After doing a crosstab analysis, we found that the proportion of homes with firearms varied significantly by where FFA members lived. For rifles and shotguns, those who lived on farms had the highest proportion, followed by those who lived in the country but not on a farm, and with the lowest proportion being reported by those who live in town. We saw the same trend for handguns as well, although a slightly lower percentage across the board. We also found that Caucasians had higher proportions with rifles and shotguns in the home than those of other races. We also did a multivariable logistic regression analysis using sex, age, residence, and race to look at the likelihood of having a firearm in the home. For rifles and shotguns, we found that males were 2.4 times as likely as females. Farms were 4.2 times as likely as those who said they live in town, and those who said they live in the country and not on a farm were 1.8 times as likely as those in town, and other races were 0.43 times as likely as Caucasians to report having a rifle or a shotgun in the home. For handguns, we again see that males were more likely than females to report this, and those who lived on a farm were more likely to report having them than those who lived in town. We also looked at how these firearms were stored. Of those with rifles and shotguns in their home, 29% stated that they were stored loaded, over half stated that they were stored unlocked, and 17% stated they were stored both unlocked and loaded at least some of the time. We did another multivariable logistic regression analysis, this time looking at rifle and shotgun storage in the home. When we looked at if they were stored loaded in the home, we found no significant differences. When we looked at if they were stored unlocked in the home, we found that males were 1.8 times as likely as females to report them being stored unlocked, and we found that our older age group, 16 to 18, were 1.3 times as likely as the 13 to 15 age group to report them being stored unlocked in the home. And again, we see that those who lived on a farm were 1.8 times as likely as those who lived in the town to report them being stored unlocked in the home. We also looked at them being stored loaded and unlocked in the home, and we found no significant differences. We also looked at rifles and shotguns being stored, loaded, and or unlocked in the home. And here we see males are more likely to report this than females. We see those who live on a farm, where 1.6 times as likely as those who live in town to report this. And Caucasians were twice as likely to report this than other races. We also asked about rifle and shotgun ammo storage, and here's a breakdown of that. 38% said that they were locked separately, 28% said that they were locked with the guns, and 25% said the ammo was not locked. 9% of them were not sure. We saw that females and 13 to 15-year-old age group had higher proportions who were unsure of ammo storage. Of those aware of ammo storage, the 16 to 18-year-old group and those living on farms and in the country but not on a farm had higher proportions that stated ammo was stored unlocked. Those living on farms and in the country but not on a farm were 1.8 times and 2 times respectively as likely as those from town to have ammo stored unlocked. For those who reported that there were rifles and shotguns unlocked at least part of the time in their home, which was 51%, 2/5 of them also had ammunition that was stored unlocked. This percentage was also higher than those who always stored rifles and shotguns locked. Of those with handguns in their home, 2/5 said that they were stored loaded. Over 2/5 stated that they were stored unlocked. And about a quarter reported that they were stored both unlocked and loaded at least some of the time. Doing the same analysis for handgun storage that we used for rifle and shotgun storage shows us that males are more likely than females to report having a handgun loaded in the home and more likely to report having a handgun unlocked in the home. We also see, just like with rifles and shotguns, those who live on a farm are 1.6 times as likely as those who live in town to report having a handgun unlocked in the home. And we also see males are 2.7 times as likely as females to have a handgun loaded and unlocked in the home. So here's the breakdown with handgun ammo storage. 32% reported that they were locked separately from the guns. 36% reported that the ammo was locked with the guns, and 22% reported that the ammo was not locked. Here, 10% said that they were not sure. We also see that females and the younger age group, 13 to 15-year-olds, had higher proportions who were unsure of handgun ammo storage. We saw this with the rifle and shotgun ammo storage as well. We also see that males, again, are more likely than females to report the handgun ammo being stored unlocked at the home, and those who lived on a farm were 1.8 times more likely than those who lived in town to have their handgun ammo stored unlocked. For those who reported that there were handguns unlocked at least part of the time in their home, which was 43%, 36% also had ammunition that was stored unlocked. This percentage was higher than those who always stored handguns locked, which was 12%. We also asked the respondents about the presence of firearms in homes that they visit. 69% reported the presence of rifles or shotguns and handguns being in homes that they visit. 16% reported only rifles or shotguns. 2% reported only handguns. And a little higher percentage, 13%, said there were none or that they were not sure. We also saw that males were 2.4 times as likely as females to report the presence of firearms in homes that they visit. And we also saw that other races were less than half as likely to report firearms being in the homes that they visit than were Caucasians. So of those who were aware of how both rifles or shotguns and handguns were stored in their own home, 82% reported that they had at least one firearm stored either unlocked or loaded at least some of the time. From these survey responses, we were able to conclude that the vast majority of Iowa FFA members have firearms in their home, and a large proportion of them are not stored safely. This puts these adolescents at risk for firearm-related suicide as well as unintentional firearm injuries and death. Widespread efforts are needed to educate rural families, especially those living on farms, regarding the importance of proper storage of firearms and ammunition. I hope you enjoyed this presentation. If you have any questions, my colleagues Dr. Charles Jennissen and Cole Wymore will be happy to.
Hi, I'm Chuck Jennissen, and I'm a pediatric emergency medicine physician at the Carver College of Medicine at the University of Iowa. And I'm going to present our abstract, Firearm Exposure and Safety Training of Rural Youth. Also listed here are some of my colleagues that were involved in this project. Next. So there's relatively few studies that really examine rural children's exposure to firearms despite their frequent presence in homes. And most people consider firearm training as being an important aspect of safety and preventing unintentional firearm injuries and deaths. Next. So our objectives in this part of the study was to investigate IOFFA members' use of firearms and whether they had received safety training, and to determine factors associated with youth using firearms and having completed a firearm safety course. Next. So, as Nick mentioned, this was part of that survey we gave to Iowa FFA members at the State Leadership Conference. Participants were asked also about their use of rifles and shotguns and handguns, including when they first used a firearm. And they were also asked whether they had taken a firearm safety course and how old they were when they were trained. So then we did some descriptive and comparative analyses. Next. So as Nick said, there was almost 1,400 FFA members in the survey. About half lived on a farm, about 20% lived in country but not on a farm, and almost 30% lived in town. Next. So the vast majority, 85% of them, had fired a rifle, shotgun in the past, and about 3/5 of them had reported doing so more than 20 times. Next. Looking at some crosstab analyses, males had higher proportion than females as having fired a shotgun, with 95% of males having done so. But still, over 70% of the females had shot a rifle, shotgun in the past. Older teens had higher proportions than younger teens. Those that lived in farms and in the country but not on a farm had higher proportions than those that lived in town still. Almost 4/5 of those that lived in town had fired a rifle, shotgun, and Caucasians had higher proportions than other races of having fired a rifle, shotgun. Next. So looking at the likelihood of having fired a rifle, shotgun with some logistic regression analyses, males are almost 6 times as likely as females to have fired a rifle, shotgun. Those that lived in farms, over 1.5 times as likely as those that lived in town, and Caucasians about 2.5 times as likely as other races. Next. We also looked at how frequently had fired a rifle, and if you looked at those that shot a rifle, shotgun more than 20 times, males had higher proportion than females. Still, females, half of them had fired a rifle, shotgun at least 20 times, and then older teens had higher proportions than younger teens. Next. With logistic regression analyses, males were almost 6 times as likely as females to have fired a rifle, shotgun more than 20 times, and those that lived in farms about 1.5 times as likely as those that lived in town. Next. We also asked the FFA members how old they were when they first fired a rifle, shotgun, and nearly 1/3 had done so before they were 9 years of age, with almost 4/5 before they were 13 years. And the mean age when the members had first fired a rifle, shotgun was about 9.5 years. Next. Males had started firing rifle, shotguns at a younger age than females, with about 2/5 of them doing before they were 9 years of age. And about 1/5 of females actually had fired a rifle, shotgun before they were 9. Next. And looking at logistic regression analyses, males were about over 2.5 times as likely as females to have fired a rifle, shotgun before they were 10 years of age, and Caucasians almost 3.5 times as likely as other races. Next. As far as firing a handgun, over 3/5, 62%, had fired a handgun, with about 30% having fired a handgun more than 20 times. Next. Males had higher proportion than females still. Females, about half of them had fired a handgun, while about 3/4 of males had. And also older teens, again, more likely had higher proportions than younger teens. And those that lived in farms or in the country but not on a farm had higher proportions than those that lived in town as having fired a handgun. Next. In the logistic regression analyses, males were almost 3 times as likely as females have fired a handgun, and those that lived in farms almost 1.5 times as likely as those that lived in town. Next. As far as firing a handgun more than 20 times, again, males had higher proportion than females, and males about 3.5 times as likely as females of having fired a handgun more than 20 times. Next. As far as how old they were when they first fired a handgun, about 1/3 had fired a handgun before they were 11 years of age. 4/5 had done so before they were 15 years. And the mean age when members had first fired a handgun was 11.9 years. Next. Again, males started firing handguns similarly as rifles and shotguns younger than females, with about 1/5 of them firing a handgun before they were 9 years of age. Next. And in logistic regression analyses, males were about almost 2.5 times as likely as females to have fired a handgun before 10 years of age. Next. We asked about hunting. Over half, 55%, had gone hunting with a rifle shotgun. Males, again, higher proportion than females. Those that were older, more than younger aged teenagers. Those that lived in farms or in the country but not on farms had higher proportions than those that lived in town. And Caucasians had higher proportions than those of other races. Next. In multiple logistic regression analyses, males were almost 3 times as likely as females, and those that lived in farms about 1.5 times as likely as those that lived in town as having gone hunting. Next. We asked when they first went hunting. Nearly quarters said they started hunting before they were 9 years of age. About half of them said they did so before 11 years of age, and nearly 3/4 before 13 years old. Next. As far as likelihood of having gone hunting before 10 years of age, males almost twice as likely as females. Those that live in country but not on a farm, almost twice as likely as those that lived in town. And Caucasians, nearly 10 times as likely as other races. Next. I do a lot of research about ATVs and other off-road vehicles. As you can see here, 92% of all the FFA members said they had been on an ATV, with 1/4 of them having carried a firearm on an AT with them. Next. So some variables that had higher proportions as far as having carried a firearm on ATV, males greater than females, almost over 2/5 of the males had carried a firearm on an ATV. Those that lived in town and in the country but not on a farm, higher than those that lived in town, and Caucasians also had greater proportions that had carried a firearm on an ATV. Next. In logistic regression analyses, males over 3.5 times as likely as females as having carried a firearm on an ATV. Those that live in farm, again, 1.5 times as likely as those live in town. Caucasians, almost 4 times as likely as other races. And since a lot of times people will use ATVs to go hunting, not surprisingly, those that hunted were nearly 7 times as likely as those who had not hunted as having carried a firearm on an ATV. Next. So we asked the FFA members, have you ever taken a formal certified hunter or firearm training safety course? Over half of them said they had. About 16% of them said that they had taken them before 12 years of age. Nearly half said they had taken a training course when they were 12 or 13 years of age. 1/5 at 14 years, and the rest of them, 14%, took them when they were 15 years of age or older. Next. As far as taking the firearm safety course, males, higher proportion than females. Older teens more than greater percentages than younger teens. Those that lived in farm and in the country but not on the farm, higher proportions than in town. Caucasians, greater percentages than those of other races. One thing that I thought was fairly interesting was that if you look at those that had unsafe rifle or safe rifle storage in the home, or again, safe or unsafe storage of handguns in the home, there really was no difference in the proportions that had taken a firearm safety course. So it didn't seem like that had much effect as far as their likelihood of having stored their firearms safer in the home if they had taken a training course. Also, those that had fired both a rifle and a handgun had higher proportions that had fired, that took a firearm safety course than those that had fired a rifle or a handgun only. By a fairly significant proportion. Next. Some logistic regression analyses, males over twice as likely as females as having taken a firearm safety course, and those that had fired both a rifle and a handgun had over 2.5 or nearly 2.5 times as likely as those who had fired a rifle or a handgun only as far as taking a firearm safety course. Next. So of those that had fired a rifle, shotgun, and or a handgun, 3/5 had taken a firearm safety course. And of those that had gone hunting, 4/5 had taken the course. Next. So in conclusion, most FFA members have fired rifles, shotguns, and handguns, and many do so at very young ages. Although many have taken a safety course, there is still a significant percentage that have not received this formal training. Rural families should be advised when it is developmentally appropriate to consider introducing youth to firearms and the importance of direct supervision when they are using them. And all the youth should really take a firearm safety training course before using any firearm. Thank you.
Hello everybody, my name is Cole Wymore, and today I'm going to be talking about rural youth's exposure to firearm-related injury and death and their attitudes regarding firearms. And I'd like to acknowledge my colleagues listed below for their contributions to this abstract. Next slide. In the shadow of recent firearm shootings in schools and the rise in teen suicide, youth have become leading voices raising concerns about firearm-related death and injury. Next slide. From 2010 to 2014, there were 13,000 deaths and more than 73,000 injuries due to firearms in youth 19 years and younger. Next. The objectives of this abstract were to understand rural youth's personal experience with firearm-related death and injury, to determine rural youth's attitudes regarding firearms, and to identify demographic factors associated with different attitudes regarding firearms. Next. And similarly to my colleagues before, the data for this abstract was collected at the FFA Leadership Conference, and demographics, information on personal experiences with firearms, and personal beliefs about firearm-related issues were collected, and descriptive and comparative analysis were performed using SPSS. Next. So like I said before, 1,400 FFA members completed the survey. 50% were males. Just over half lived on a farm. Just under 1/5 lived in the country but not on a farm. 29% lived in the town, and 96% were Caucasian. Next. Nearly 1 in 20 of those surveyed stated that they had personally seen someone threatened by a firearm. And of those who had personally seen someone threatened by a firearm, 32% stated they saw a family member being threatened. Just under 2/5 saw a friend being threatened by a firearm. 11% said that they themselves were personally threatened. And just over a fourth said they saw some other individual being threatened by a firearm. Next. And so our crosstab analysis. Other races had higher proportions who had seen someone threatened by a firearm compared to Caucasians. There was no difference in the proportion of those who had a rifle or shotgun in the home compared to those without a rifle or shotgun. And those with handguns in the home had higher proportions than those with no handguns. Next. And for our multivariable logistic regression analysis, other races were over 2.5 times more likely than Caucasians to have personally seen someone threatened by a firearm. And those with handguns in the home were 3 times more likely than those with no handguns in the home. Next. Over 1/3 of those surveyed stated that they personally knew someone who had been killed or injured by gunfire. And when we asked them, who do you know that has been killed or injured by gunfire? 13% said that they knew of a family member who had been killed or injured. Just under a fifth said they knew of a friend. 10% said that they knew of some other individual. And 0.2% said that they themselves had been injured by gunfire. Next slide. Of those participants who knew someone who had been killed or injured by gunfire, 77% personally knew of at least one person who had died or was injured accidentally, and just under a third personally knew of someone who had been killed or injured on purpose, for example, suicide. Next. Higher proportions of females personally knew of someone killed or injured by a firearm compared to males. Those with rifles or shotguns in the home had higher proportions than those with no rifles or shotguns. And those with handguns in the home had higher proportions than those with no handguns. Next slide. Females were over 1.5 times more likely than males to know someone killed or injured by a firearm. Those who lived in town were almost 1.5 times more likely than those who lived on a farm. Those with unsafe and safe rifle or shotgun storage in the home were more likely to know someone killed or injured compared to those with no rifles or shotguns. And those with unsafe handgun storage in the home were almost 1.5 times more likely than those with no handguns in the home. Next slide. And so we also proposed several statements and asked those surveyed to rate how much they agreed or disagreed to the statement to try to gain some information on their attitudes regarding firearms. And for the statement, the right to use firearms for hunting and sport shooting should be kept legal, 94% of those surveyed either strongly agreed or agreed with this statement. Next slide. And several variables were identified as having higher proportions. Higher proportions of males compared to females. Those who were older had higher proportions than those who were younger. Caucasians had higher proportions who thought that firearms for hunting and sport shooting should be kept legal compared to other races. Those with rifles or shotguns in the home had higher proportions than those with no rifles or shotguns. Those with handguns in the home had higher proportions than those with no handguns. Not surprisingly, those who had hunted had higher proportions who agreed that firearms for hunting and sport shooting should be kept legal compared to those who had not hunted. And we also see that those who had fired a rifle more than 5 times had a higher proportion that agreed to this statement compared to those who had fired a rifle less than 5 times, who had a higher proportion than those who had not fired a rifle. And we see this same exact trend with handguns as well. Next. Males were almost 2.5 times more likely than females to agree that firearms for hunting and sport shooting should be kept legal compared to females. Those with rifles or shotguns in the home were almost 2 times more likely than those with no rifles or shotguns. And those that hunted were over 3 times more likely than those who had not hunted to agree with this statement. Next. The vast majority, or 89%, agreed or strongly agreed that a firearm safety course should be required to get a hunting license. Next. Higher proportions of females agreed with this statement compared to males, and those that had fired a rifle less than 20 times had higher proportions than those that had fired a rifle greater than 20 times. Next. Females were over 2.5 times more likely than males to agree that a firearm safety course should be required to get a hunting license. Next slide. For the statement, there should be a background check required by law before someone can buy a firearm. 90% of those surveyed either strongly agreed or agreed with this statement. Next. Those that had not hunted had higher proportions that agreed with this statement compared to those who had hunted. And those that had fired a handgun less than 5 times had a higher proportion that agreed that there should be this background check required by law compared to those who had fired a handgun more than 5 times. Next slide. Over 3/5, or 61%, agreed or strongly agreed that there should be laws requiring safe storage, meaning locked and unloaded, of firearms in homes. Next. And here there was several variables that had higher proportions. More females compared to males. Those who were younger had higher proportions than older ages. Those that lived in town had higher proportions than those who lived in the country but not on a farm, who had higher proportions than those that lived on a farm. Those with no rifles or shotguns or no handguns in the home had higher proportions that agreed that there should be a law requiring safe storage compared to those with safe storage of those weapons, who then had higher proportions of than those with unsafe storage of those weapons. Those that had not hunted had higher proportions that agreed to this statement compared to those that had hunted. Those that had fired a rifle less than 20 times had higher proportions than those that had fired a rifle greater than 20 times. And those that had not fired a handgun had higher proportions that agreed compared to those that had fired a handgun 1 to 5 times, who had a higher proportion than those who had fired a handgun 6 to 20 times, and then had higher proportions of than those who had fired a handgun greater than 20 times. Next slide. Females were almost 2 times more likely than males to agree that there should be laws requiring safe storage of firearms. Those that lived in town were almost 1.5 times more likely than those who lived on a farm. Those with safe rifle and shotgun, shotgun, and handgun storage in homes were more likely than those with unsafe storage. And those who had not hunted were over 1.5 times more likely than those that had hunted. Next. So in conclusion, over 1/3 of FFA members personally knew of someone who was killed or injured by a firearm, and about 5% had seen someone threatened or had personally been threatened with a firearm. And the majority of youth in this study agreed that hunting and sports shooting should be kept legal, but they were also in favor of firearm safety measures such as required training, background checks, and safe firearm storage. And there were certain demographic factors that were associated with differing attitudes regarding firearms, and this may be important to address in firearm injury prevention efforts. And screening at healthcare visits or in schools may help identify youth with negative personal experiences from firearms who might benefit from mental health intervention. Thank you very much.
Great job, Cole. Really, really well done. If Nicholas were here, I would say the same to him. And Dr. Jennissen, thank you for leading this research in general and for making these 3 abstracts possible. They are an important and very timely contribution to the literature. I really will highlight that up until these abstracts have been presented, we've known very, very little about the beliefs, practices, and training opportunities of our rural firearm using youth. So thank you for doing this. With that said, I'm going to lead into a few questions. Dr. Jennissen, you'll be taking the questions directed at Nicholas's presentation, correct?
Sure.
Great, thank you. So I'm going to start with 1 question for each of you, and then I'll go into our chat questions if we have time. So the first one is regarding that first presentation, Nicholas's, which is what do you think could be done to increase the proportion of homes, of rural homes, that practice safe storage of their firearms or safer storage of their firearms?
Yeah, it's a challenging thing, obviously. Somebody brought up a question at actually in the QA, and that I answered earlier. Basically, had asked, how frequently do they talk about safe storage in training courses? And I don't know how well they do, but certainly they do emphasize more on safe handling and probably not so much on safe storage. And that certainly would be a type of thing that could potentially have some factor in people improving their safe storage of homes. I think, there were some other abstracts represented about possibly increasing through, Mike Gilliman earlier gave an abstract about some of the efforts that Ohio AAP is doing in getting healthcare providers more involved. and I think that's great, although a lot of some studies have shown that people in the rural areas are not as likely to listen to healthcare providers regarding these kind of issues as other people like law enforcement or people that sell guns. And so I think that having those people be more involved in far as training and giving information about safe storage and encouraging the sale of safe storage items would be an important aspect.
Yeah, I want to echo that. I just think that, and I know that Dr. King had asked that question. I know she's doing some work up in the UP in Michigan, and in our work, my work with your rural youth as well, that we've really found the importance of having that trusted messenger, which is not to say that physicians can't be it. We know that there are surveys showing that we can, but we need to come at it from a culturally competent and harm reduction approach, and that we may be far more effective if we do engage those trusted messengers like the shooting sports instructors or law enforcement officers, peers. So I love that. And Dr. Jennissen, would you mind just going over quickly what some of those safe storage or safer storage options are for those who are listening who may not be familiar?
Yeah, I was going to say first, another place like these are FFA members, having the FFA clubs actually maybe make it something that they champion and be involved with and to encourage. I think that would be another good way. And as you mentioned, FFA leaders, who I know some of them are like the trap shooting team, coach actually as well. So yeah, there's a lots of different things for safe storage, gun locks, trigger locks, and then cable locks, gun safes, and lock boxes. I mean, there's all kinds of different options. A lot of these have ability to try to access them, or you can access quicker than others, and depending on why people have handguns or rifles in the home, if it's related to protection. Some of these that have a quicker ability to access them would be important. So yeah, I mean, there's a variety of things that we could talk about those, I guess, but those would be some of the different options.
Awesome, thank you. And I love that kind of comment on recognizing why someone owns a firearm, helping to inform what type of safe storage is going to be most likely to be effectively used by them. Anything is better than nothing. There's like the safest, but any movement that we can make towards that is helpful. And so recognizing people's motivations for owning helps to inform the choice of the best form of safer storage for them. So thank you. Cole, I think that one of the things that probably surprised many of us about your presentation was the percentage of rural youth who personally know someone who's been injured or killed by a firearm. And so one question that we've been asked is, what factors do you think, based on your work, both presented here and your other experience, what factors do you think might influence rural youth's exposure to firearm injury and death? What do you think explains this?
Yeah, I think that's such a great question. I think it's definitely multifactorial. I think it's not only do these individuals have higher portions of ownership of firearms, but I also think that it's, they aren't storing them properly. So some of those things, I think it might be just the exposure aspect, but I also think there's a cultural type of thing where these individuals aren't necessarily handling them properly. I think a lot of it has to do with hunting in our rural communities is very popular. Dr. Jennissen mentioned transporting them on ATVs. So I think there's a lot of different reasons why these individuals have higher experiences of seeing people being injured or killed. And it would definitely be an interesting project to kind of take up and dive more deeply into that.
I think that definitely the access to firearms and the number of kids who have used them for suicides in rural areas definitely has a factor. We know, as Nick's presentation, he talked about how the more rural any kind of place is, starting from the most densely populated to the less densely populated, the increasing of suicides related to firearms. And so in rural areas, unfortunately, they're going to know a lot of these people. They're happening enough that they do know people who have killed themselves with a firearm. And as Cole is saying, the unintentional firearms, one of my cousins, was in basically on a deer stand and was tapping a rifle on the deer stand, and it went off and killed him. And so, the fact that a huge proportion of these youth are basically hunting puts them a little more at risk for potentially having an unintentional injury, either even while they're hunting or after. Just recently, I saw a child who was had gone hunting for birds, and he was going to trap shooting practice. The rifle that he had been using apparently had still something. It had a shell in it yet. It tipped over and went off and shot the ankle of another trap shooting member there that was ready for practice. So these kind of unintentional things are going to be more likely to happen when you have that kind of access and use of firearms.
Thank you. Sorry for the background noise. My children are doing distance learning, hence my little screen here, so you guys don't see them running. No BBC moments for us today. Thank you. Cole, there was a question in the chat. There are actually 2 questions in the chat for you, and I'll actually direct them to Dr. Jennissen as well. We only have a couple minutes left, but about Cole's conclusion about kind of the mental health needs of youth. And then relatedly, this is from the same questioner, Dr. Jennissen, about whether you guys asked about the type of rifles. I know you answered in the chat that you didn't, and I'll say that in my work with firearm owning populations that we found that asking what type of long gun it is actually makes people just stop engaging because they think that we're trying to come at it to take it away. But I'd be interested in your perspectives on both of those questions, both the mental health aspect and kind of why you think that's necessary, and then also relatedly on kind of how we get at more accurate information about ownership, recognizing these, understandable fears on the part of some study participants.
Yeah, definitely. I think just as kind of piggybacking off what Dr. Jennissen said, and the high rates of suicide in these rural communities, and I think it's really something that we need to address, not only in rural communities, but just kind of across the board, is the mental health aspect and the access to firearms. And I think, like he had mentioned, the previous abstract, talking about screening in hospitals and in primary care visits, I think that's an extremely important aspect. But I also think that social programs out in the community and making, kind of decreasing the stigma of some of these mental health issues, and making sure that, individuals and especially adolescents don't have access to these firearms, during that critical period of a mental health issue or episode.
Thank you. And I've unfortunately been informed that we've run out of time. So although I asked a 2-part question, I think we've run out. So I want to say, just as closing, first of all, thank you to the 2 of you, and to please communicate to Nicholas our immense appreciation. I do want to highlight, as someone commented, that this is a start, right? This is a cross-sectional survey of a small portion of youth from one state. And so we're hopeful to see follow-up studies that both geographically help us to extrapolate, that explore some of these underlying drivers or factors in more detail, and that help to move the field forwards in terms of what we can not just know about patterns, but also what we can do.